Hello, everyone, and welcome. My name is Kelly Berry, and I'm the Executive Director of the American Heart Association for the Central Valley and Kern County region. I'll be your host today for our conversation, and I am joined by Dr. Jeet Singh, cardiologist from Centric Health. It is my pleasure to welcome guests across the Central Valley to the American Heart Association's community conversation about COVID-19 and vaccines, sponsored by Centric Health. There's no doubt COVID-19 has changed all of our lives. It has impacted our families, our work, and caused immense challenges to be borne by the global community. 2 vaccines are currently authorized by the U.S. Food and Drug Administration, and the public and private sectors have worked hard to get people vaccinated. At the same time, people understandably have questions about the vaccine, how it was developed, if it's still relevant. Today, we will try to answer as many questions and give you the information you need to take home for you and your family. We are so excited to have you join us. Before we start, just a few notes to the audience as well. Please use the Q&A button on your Zoom toolbar to submit questions for a live or typed response. Use the chat button to introduce yourself and share comments or thoughts. Also, we'll be on the lookout for some resources and the links from the AHA as well. Staff will be posting some of those, so feel free to use those. If you would like live captioning of the presentation, use the closed caption button to turn on those captions. And because this is a webinar, you don't need to worry about muting or unmuting, sharing or anything else. Just sit back and relax and enjoy with our virtual friends here. Now a little bit on to Dr. Singh. Dr. Singh pursued his internal medicine residency and cardiovascular fellowship at Chicago School of Medicine. Upon finishing cardiovascular training, he was accepted into the interventional cardiology fellowship at Cedars-Sinai Medical Center in Los Angeles. Dr. Singh became board certified in interventional cardiology in 2011, and then shortly thereafter moved to Bakersfield, California to practice. We're so lucky to have you here, Dr. Singh. Both in residency and in fellowship, Dr. Singh was selected as a clinical instructor and chief cardiology fellow to guide and mentor cardiology fellows, internal medicine residents, and medical students. He has a passion for managing complex cardiovascular cases, and either through performing clinical or surgical intervention, he impacts the lives of his patients for the positive. He has published over 30 clinical research studies, authored several book chapters, and has presented his findings at various cardiovascular conferences. We are so excited to have you today, Dr. Singh. I'm going to turn it over to you.
Hi, Kelly, and wonderful audience. Thank you for the kind introduction. I would like to take a moment to review what we know about COVID-19 and our most vulnerable population. Dealing with COVID has changed the way many people lives, including adopting behaviors that are known to increase the risk of heart disease and stroke. Things such as unhealthy eating habits, increased consumption of alcohol, and lack of physical activity during the quarantine isolation in years past, as well as the stress of returning to normalcy. For more information on how the pandemic ripple affects health, a link to a new article has been included in this chat today. For people with underlying heart disease, the concerns are serious. The research indicates people with coronary artery disease or hypertension are more likely to be infected and to develop more severe symptoms. The risk of death from COVID-19 related heart damage appears to be as or more important than the other well-described risk factors for COVID-related mortality, such as age, diabetes, COPD, what we call chronic pulmonary disease, or prior history of cardiovascular disease. Earlier in the pandemic, 40% of hospitalized COVID patients had cardiovascular disease or cerebrovascular disease, to mention. While the virus main target is the lungs, It can also affect the heart, especially a diseased heart, which needs to work harder to get oxygenation. Someone with a heart disease may also have a less robust immune system. Recent research has shown that the people who contracted COVID and had uncontrolled blood pressure were more likely to be poorer health outcomes than people who contracted and had their blood pressure under control. Others facing this higher risk include people 60 and above, pregnant women, young children, people with diabetes, and serious chronic lung and kidney conditions. People with compromised immune system are also affected. Stroke survivors may also have a higher risk of complication. Let's watch a quick clip regarding the risk of our older adult population. The American Heart Association has an infographic showing the pandemic impact on cardiovascular disease, as you can see in this slide. The number one pandemic caused a serious cardiovascular event where more people died from cardiovascular disease than in any year since 2003. The people of color were mostly impacted, with proportionately more Black, Hispanic, Asian, and American Indian dying from cardiovascular disease during the early pandemic compared to white people. For all these reasons, the American Heart Association is still concerned about the COVID-19 virus. The Centers for Disease Control, that we call as CDC, and preventive recommends everyone age 5 years and older get a 2023 to 2024 updated vaccine to protect against potentially serious outcomes of COVID-19 illness, including long-lasting effects of the disease known as long COVID. Early in the development and distribution of the vaccines, many people had concerns and some were hesitant to receive a vaccination. These concerns were related to the safety and side effects of the vaccine, the speed of which the vaccines were developed, distrust in the political and economic motives of those involved in the vaccine development, and theories involving vaccine. Today, close to 70% of US population has completed their primary series of vaccination, according to the CDC as of May 2023. Only 17% of population, however, has received an updated booster dose. People are looking for information to address these concerns. So today we will go through what the science tells us, what researchers know, and hopefully answer the questions that may be standing in the way of your initial vaccination or continued booster doses. Thank you.
Thank you, Dr. Singh, for setting the scene on where we are with COVID-19 today. Now we're going to transition into what the vaccine means to us today. Audience members, as a reminder, please share your questions in the chat and we will address them with Dr. Singh at the end of this presentation. First, let's remind ourselves of how COVID-19 affects the body by watching this video featuring Dr. Mitch Eklund, American Heart Association president and stroke neurologist at Columbia University.
This virus, when it first, as we were talking about at the beginning, as the numbers were shooting up in New York back in March, we thought we were dealing with a lung disease, right? and it turns out that it's much more than that, because the way that the virus gets into the cells of the body is by binding to this receptor called ACE2. It's an enzyme in the body. It's just that the virus has, through evolution, this virus arose in such a way that it recognizes this enzyme that we all have, binds to that, and then gets into our cells. And that enzyme, that protein, is located on cells in the lungs. So when we breathe it in, it gets into the lungs. But that same enzyme is present on the heart. It's present in the gastrointestinal system, the stomach and your intestines. It's also present in some of the nerve cells, which is why we see some neurological problems from it. But the really scary thing is that it's also located on the linings of the blood vessels that go throughout the body, okay, what we call the endothelium. So every one of your blood vessels is lined with these cells. It's like a skin within the blood vessel, and it's very important for regulating the function of the blood vessel. And this virus will bind to that enzyme on the surface of on the inside surface of the blood vessel and go into the lining there, and then it can set off blood clotting. And that's why we see clotting throughout the body from COVID. So it's not just a lung disease, it's just that it gets into the body through the lungs, causes lung problems. Some people, the lung problems don't even seem to be the major problem. It's when it gets into the blood vessels that it causes trouble.
Early in the development and distribution of the vaccines, many people had concerns, as we mentioned. So I think this was a wonderful slide. So 2 vaccines named for the companies that make them are available in the United States. First is the Pfizer BioNTech, and the second Moderna. Originally, there was 3, the third being the Johnson & Johnson, that we call Janssen vaccine, but that vaccine is no longer available in the US. All remaining US government stocks for Janssen COVID-19 vaccine expired May 7th, 2023. However, another updated COVID-19 booster made by biotechnology company Novavax is awaiting federal authorization and recommendations for use.
Thank you, Dr. Singh. Can you explain to us how do these vaccines work?
Sure. So the Pfizer and the Moderna vaccines are a type called a messenger, what we call as mRNA vaccine. The Novavax is a protein-based or protein subunit vaccine. All these vaccines teach the body how to fight the virus that causes COVID-19 without you actually having to get the illness. Research shows that the vaccines can help protect you from getting COVID-19, although fully vaccinated people can get infected. That's called a breakthrough infection. But more importantly, vaccination has been shown to greatly reduce the risk of getting seriously ill and being hospitalized if you do get COVID-19. Vaccinations may also help protect against long-term COVID-19 related illness.
What is the difference between these vaccines?
All these available vaccines are safe and effective. That's first thing. If you were given the Pfizer vaccine, you should have a second shot 21 days after the first one. If you get the Moderna vaccine, you need a second shot 28 days after the first. Your card might list when your second shot is due, although providers are often scheduling appointments separately online or by the phone. When you were first vaccinated, your provider should have advised you about whether you need a second shot and how to schedule it. If you are unsure, check the CDC COVID-19 vaccination record card you received at your first visit.
Thank you, Dr. Singh. Can I get COVID from the vaccine?
No. None of the vaccine available in the US contains the live virus. But because the vaccine teaches the body to recognize and fight the virus that causes COVID-19, you might have side effects like fever, which can occur when the immune system is working hard, building your immunity to the virus. Also, it's possible you could already have COVID-19 but not be feeling symptoms before vaccination, or could catch the disease right after your shot before your immune system can protect you.
Great, thank you. Now, let's take a minute to discuss the vaccine's safety and effectiveness. Are the vaccines safe?
COVID-19 vaccines are safe and effective. The COVID-19 vaccines were evaluated in tens of thousands of participants in clinical trials. The vaccines met FDA rigorous scientific standards for safety, effectiveness, and manufacturing equally. These vaccines have undergone the most intensive safety monitoring in US history. This monitoring includes using both established and new safety monitoring systems to make sure that COVID-19 vaccines are safe.
Wonderful. Should I get the vaccine if I have a history of heart disease or stroke?
Yes. As we discussed earlier, people with cardiovascular risk factors such as heart disease and heart attack and stroke survivors should get vaccinated as soon as possible because they are at much greater risk for virus that they are from vaccine, according to the leaders from American Heart Association. The association urges people with medical conditions to discuss vaccination with their healthcare team.
Thank you. Does vaccination affect other medical procedures I might have or have to have?
You should consult with your healthcare team about the times of your COVID-19 vaccinations and boosters if you have recently been in the hospital or had surgery, or another procedure requiring anesthesia, or if any of these are coming up. Routine blood work and most other medical procedures and screening can be performed as usual before or getting your COVID-19 shot, the CDC says. These include dental procedures, the CT scans, the electrocardiograms, the cardiac stress testing, the ultrasound, and colonoscopy. For women, if you are directed to have your regular mammogram, if possible, get your mammogram before the COVID-19 shots or talk to your healthcare team about how long to wait afterwards. Some experts will advise waiting for 4 to 6 weeks. As part of the normal immune reaction that occurs after COVID-19 vaccination, you might have lymph node swelling in the underarm near where you received the shot. The swelling might cause a false reading on your mammogram.
Thank you. Am I better protected if I get infected naturally?
There is no way to predict how COVID-19 would affect you. The severe COVID-19 illness and even death have occurred in people of all ages, including healthy people. And if you get infected, you could spread the illness to other vulnerable people. By contrast, federal regulators have determined that the benefits of each vaccine outweighs any risk. The vaccine has been tested in thousands of people in clinical trials and continued to be monitored closely.
Thank you, Dr. Singh. Now, let's shift a little bit to the actual vaccination process. Do I need to pay for the vaccine if I'm receiving this?
During the national COVID-19 public health emergency, the vaccines were paid by the federal government and provided free of charge to everyone. Now that the emergency has ended, you may have to do a little research upfront to get the latest shot for free. Because it's considered preventive care, the new COVID-19 vaccines are covered 100% by Medicare, Medicaid, and most private insurers. Be sure to use an in-network provider. If your plan requires it, you can check with your insurer or the vaccine provider in advance. If you are uninsured, or if your insurance will require any payment for COVID-19 shot, you can still get the vaccine for free through the government's Bridge Access Program. To find these free vaccinations, go to the vaccines.gov, search using your zip code and which COVID-19 vaccine you want, and on the next screen, choose Bridge Access Program Participant. The Bridge Access Program is authorized through 2024.
Thank you. How should I get ready for this vaccination and what should I expect?
Allow plenty of time for your vaccination and plan for only light activity for the day or so afterward in case you feel a little ill or sore. If you have a chance to fill out paperwork online before you visit, you'll save time at your appointment. Check with your doctor or vaccine provider about whether any medicines you are taking might be a problem. The CDC advises against taking antihistamines or over-the-counter painkillers such as acetaminophen, aspirin, or ibuprofen solely as a measure to prevent vaccine side effects. Bring your photo ID, your insurance card, if applicable. If this is your second shot, bring the CDC COVID-19 vaccine record card that you received at your first visit. Be sure that you and anyone who accompanies you for your vaccination is masked. Continue to practice social distancing while in line for your vaccination. Be sure that you and anyone who accompanies you for your vaccination is masked. Continue to practice social distancing while in line for your vaccination. The actual shot given is in the upper arm muscle will only take a few seconds. Afterwards, you'll be asked to wait 15 to 30 minutes to ensure that the risky but very rare and treatable allergic reaction called anaphylaxis does not occur. Healthcare providers on sites are ready to treat anyone who has this reaction. What are the most common side effects? That can be another question that will be relevant in these cases. To answer that, many people have no side effects from COVID-19 vaccination. Many other experience minor few days, including pain, redness, or swelling at the injection site, fatigue, headache, or muscle pain. Some patients also get chills or fever, and sometimes nausea. The side effects are more common after the second shot in the two-shot series. Call your healthcare team if these effects last more than a few days, are worrisome, or if the redness and swelling in your arm worsens after 24 hours.
Are there serious side effects?
Very rarely, a severe dangerous allergic reaction called anaphylaxis can occur shortly after your shot. Symptoms of anaphylaxis include a swollen throat, a rash that can itch, wheezing or other trouble breathing, and passing out. If you think you are having such a severe reaction after you leave your vaccination site, call 911 immediately. Early research have found that among almost 1.9 million doses of Pfizer vaccine administered in December 2020, just 21 cases of anaphylaxis were reported. Over 70,000 of these happened within 15 minutes of when the shot was administered. That's why there's a short waiting period with healthcare providers standing by after your vaccination. You should also have a less severe allergic reaction within 4 hours of your shot, with symptoms such as hives, swelling, and wheezing. If you have either of these allergic reactions, the CDC recommends you not get a second shot of that type of vaccine.
Thank you, Dr. Singh. Now let's talk a little bit more about what happens once you do get the vaccine. I was vaccinated against COVID-19 soon after the vaccines became available. Am I still protected?
You are not as well protected now as you were then. In the US, nearly 70% of people completed an initial course of recommended doses called the primary series of vaccination. But the effectiveness of the vaccine fades over time, meaning booster shots are needed to help maintain the protection. Also, the virus that causes COVID-19 has changed or mutated in the form since the pandemic early days, creating a need for updated vaccine formulation that targets the newer forms of the virus.
Another question is, I've already had COVID-19 booster shot or 2. Do I need another shot?
Federal officials recommended that almost everyone gets one of the newest vaccinations. Booster shots have been available beginning in the fall of 2021, but they have evolved. In September 2023, the Food and Drug Administration approved the newest formulation of COVID-19 shots produced by Moderna and Pfizer for 2023 to 2024. These updated monovalent vaccines target one newer variant of COVID Omicron strain called XBB 1.5 and are expected to also increase defense against other related variants that are now spreading.
Thank you. Which COVID-19 vaccine should I get if I've never had one before?
You should get a dose of either the newest Moderna or newest Pfizer vaccine released in September 2023, according to CDC. You don't need both.
Thank you, Dr. Singh. There are definitely some special considerations regarding the vaccine. We did get some questions in the chat, so let's look at some of those too. Can children get vaccinated?
Let's watch a video clip from the AHA on this topic to help answer this.
Thank you, Dr. Singh. If you'd like more information about children receiving the vaccines for 5 to 11-year-old children, a link is in the chat with more information provided. Continuing about special considerations. Should I get vaccinated if I'm pregnant or planning to be pregnant?
Yes, the CDC recommends an updated 2023-24 COVID-19 vaccine for women who are pregnant or are anticipating a pregnancy. Pregnant or recently pregnant women face an elevated risk of death or severe illness from COVID-19, including illness requiring hospitalization, intensive care, or a ventilator, or other special equipment to breathe, according to CDC. Also, risk of pregnancy complications with COVID-19 is higher. Women who are breastfeeding or might become pregnant also are urged to get vaccinated. There are no evidence that any vaccine, including those protecting against COVID-19, cause fertility problems for women or men. That's what CDC says.
Thank you, Dr. Singh. If I've already had COVID-19, do I still need to be vaccinated?
Yes. Vaccination will provide extra protection against another case of COVID-19 because reinfection is less likely during a short window after having COVID-19. You may consider delaying your vaccine by 3 months from your symptoms started or when you tested positive. But you should take into account your personal risk and rates of COVID-19 in your community, the CDC says.
Thank you, Dr. Singh. For our final question of the day, Dr. Singh, will we need to receive COVID-19 booster shots?
Many experts expect COVID-19 vaccination to be recommended annually the way the influenza vaccine is now. You can actually get your COVID-19 shot at the same time as you get the flu vaccine.
Great. Thank you. Thank you so much, Dr. Singh, for your expertise. As we said earlier, the American Heart Association is still concerned with the COVID-19 virus. The association is asking everyone to get vaccinated and stay consistent with your boosters as they are eligible. There are also ways you can be involved in helping spread the word, assisting others to making the decision to get vaccinating and maintaining their booster and helping as well. At this time, we'd like to take any questions from the audience members for Dr. Singh. Again, please put those questions in the chat. Let me see, I'm sure we have a couple for you, Dr. Singh.
Sure.
Can these vaccines cause someone to develop heart block?
Vaccines can have side effects. The COVID-19 vaccines, for example, has been linked to rare cases of myocarditis or pericarditis, the types of heart inflammation. A study in England published in Circulation in 2022 found 10,500 more cases of dangerous blood clots among 1.4 million COVID-19 patients than would be expected without COVID-19. Ultimately, the benefit of the vaccines outweighs the small amount of cases.
Thank you, Dr. Singh. Another question from the audience is, should I be planning to get a vaccine annually?
You should be planning to get vaccine annually. As we just mentioned, for you receive a flu shot. In fact, you don't have to space it. You can get it at the same time.
Wonderful. Thank you. Okay. One more question from the audience. And again, please continue to put your questions in the chat and we can refer back to them. Is it better to get one vaccine over the other?
Actually, there is no bias towards one vaccine. As I went through my slides to re-emphasize, all these vaccines which are being administered in US, both of them have been tested aggressively under supervision through various measures taken by the FDA and CDC. So there is no preference one over another.
Perfect. Thank you so much, Dr. Singh, for your time today and all of your insight. We so appreciate your time and we know how busy you are. So thank you again. Now we actually have a guest community member who would like to share his experience with COVID. He is a researcher at a California-based biotech company where he works to understand and develop therapeutics for rare genetic diseases. He earned his PhD from the University of California, Merced, and during the time of living in Central California, was deeply involved with the community as an educator, a mentor, and an entrepreneur. He currently lives in Concord, California with his wife and 3 children. Thank you, T, so much for being willing to share your story with us. I'm gonna dive into some questions if you're ready for us, T.
Thanks for having me. This is really an informative session. Thank you, Dr. Singh, and thank you for American Heart Association for putting this together.
Awesome. Thanks, T. Prior to getting COVID, T, did you have any pre-existing conditions, hypertension, diabetes, anything of that sort?
No, but at the time of my COVID, not only did not have any pre-existing condition, but I also was not taking any medication, and I'm also relatively younger than the most risky age groups.
Okay. Were you vaccinated at the time?
No, I was not vaccinated. It's at the time I was a little bit hesitant, and for a different reason than the ones that are listed on Dr. Singh's slides. But everybody in the house was, except myself, and I'm the one who got the COVID and felt the most of the symptoms.
Speaking of symptoms, T, what were your initial symptoms that came on?
Oh, the list is a long list, and then as time goes by, I wish I could capture the feeling that I had back then. But mostly, I had no taste, zero taste. My appetite was gone. Severe headache, a little bit of difficulty breathing, and then sleep was hard to come by. It was always some activity going on in my head. I can't describe it really fully, but um, yeah, those are the main symptoms, and not being able to eat, and that can, has its own effect.
Did the symptoms seem to progress as the days went by?
Oh yeah, it just got worse, and I didn't think it was going to get better. And there are times when I thought that was it. This is it for me. But luckily, after a couple of weeks, my taste was still bad, but my appetite came. I started eating a little bit. I was, a lot of fluid. I was taking a lot of fluid. I was taking medications. And then I started sleeping during the night. So I noticed that I'm getting better. So, and then after 2-3 weeks, I started mixing with the family.
Great.
I was isolated before, yes.
Yeah, absolutely. How did you treat the illness, and what level involvement did you have from your doctor during the time you had COVID?
That's a great question. I consider myself a very lucky person. At the time, when I got the COVID, all hospitals around the nation were, over capacity. I mean, if you go to the hospital, it's, no telling. I was very lucky to have a nurse who is my wife. I see somebody in the chat is from Bakersfield. Shout out to Bakersfield. My wife is from Bakersfield. And then also her uncle was in the house at the same time. He was also a doctor, emergency doctor. So they were advising me and giving me medications, a lot of fluid, and trying to force me to eat and things like that. Of course, isolation. I was, I had, the luxury of having my own room to isolate in. I know that's not the case for a lot of families and a lot of people. So most of the things that were available to me were not true for a lot of people. The isolation, even having a doctor and a nurse at your disposal, was not the case. So I was very lucky at that time. So I was, I got a little care. If I needed something more as far as treatment, I would have, had to go to the hospital. But thank God that I didn't. My breathing was labored at times, but not painful, and not 100% hindered. So I'm very grateful for that.
Absolutely. Thank you for sharing that with us. Have you gotten COVID again since that first time? And if so, were the effects the same as the first time around?
I have. Look, at first I felt bad because I'm thinking, a lot of people that know me know we were taking, we don't go, we didn't go shopping. We were getting Instacarts, and we spray everything in front of the garage, and, clean everything. And then, I know some people might feel it, maybe you're bad for getting COVID, but, it's not like that. I did get COVID again. And thank God, after that first one, I went and got my vaccination. So when I got the COVID again, I was fully vaccinated, and the symptoms were not as bad. I didn't lose my taste. At first, I didn't even know I had COVID. I had probably had a flu-like symptoms, and but we were routinely testing, testing every week at the time. So I saw it positive, and minor aches on my throats and things like that. But no, it was not as bad.
Well, good. Glad to hear that. Considering, I've got one more question for you, T. Thank you for sharing your story again. Considering your personal experience with COVID and the guidance Dr. Singh has shared today, how are you protecting yourself and your loved ones from COVID in the future?
Well, to start with, at first when I got COVID, one of the things that we did was isolation. we really were big on that. This is before disinformation. And two, we were testing regularly to find out if we have COVID, and also taking precautions such as, social distancing and things, everything that was recommended by the experts, CDC, WHO. If somebody's, an expert, I'm listening, because usually we can't have all information at our disposal. And those people are experts. Dr. Singh is a Dr. Singh for a reason. And their presentations, I take all those at high value. I listen to those things, and some of the things that we're doing are everybody's vaccinated in our household. And now that I have, some of the things that I heard today, were like, I didn't know that we're going to start taking, vaccination of COVID every year, just like flu. My wife is a nurse, and she's really stickler about those flu shots, and I'm sure she's going to roll out that COVID shot as well. So that's one of the things we do. And then really, for me, it's not what I'll do based on what I learned today, but in general, my rule of thumb is, listen to the experts, keep plugged into the experts and what is recommended. And because I work in the industry of making medicine, I know what kind of rigor goes to it before approval. So I trust those expert advices. That's what I wanted to add to this discussion.
Absolutely. Thank you so much, Chief, for sharing your experience with us and your feedback from today. I think some people might think of COVID as only a cough or a sore throat, at all. So your story really serves as a reminder that it is more important than that, and to make sure you're, aware. Thank you so much again, T, for being here with us today.
Oh, no problem. The other part of COVID that we don't really talk about is emotionally. I was emotionally drained during my first COVID. And then, like I told you, the mental aspect of it. Another thing is, am I bad for getting COVID multiple times? Like, am I not careful enough? That's not, also not true, that I've learned. And then also, there's a lot of talks that are going in the community, whether political or anything like that. To me, my number one emphasis is for me and my family is I want me and my family to be healthy. So we wanted to be conscious of being healthy. That includes, our diet, exercise, but also, this preventable diseases like COVID, that we can protect ourselves using the vaccine or any other advices that come from the experts. So even mentally, that, gives a bonus. It's emotionally being protected. So I just want to add that for the listeners. Since I'm sharing my story, I wanted, to share a complete story.
Absolutely. Thank you so much again. We can't thank you enough for being here today. So we appreciate your story, and we hope you and your family stay safe for sure. Today we touched on some information about COVID-19 and its vaccines, and we wanted to leave you all with additional resources. So please see in the chat some links for that information. With the holidays quickly approaching, we'd like to offer one more resource about practicing gratitude and improving mental health as well. Speaking of, such a big thank you to Centric Health for sponsoring this event. Lastly, thank you to the audience for listening with open ears and for contributing to the conversation and tuning in today with your questions as well. This webinar will be posted to the American Heart Association's YouTube channel. A link will be provided in a follow-up email for those of you that have registered and they're here today. Please feel free to share and rewatch this content as you need. And everyone, thank you so much again, and have a wonderful day.